The international self-care is recognized as an essential ethical responsibility in the counseling profession. Counselors frequently work with clients experiencing trauma, grief, anxiety, depressions, and other forms of psychological distress, making them vulnerable to stress, burnout, and professional impairment if self care is neglected. Professional competence is closely linked to personal well being. Counselors who maintain their psychological health are better able to demonstrate empathy, ethical decision making, and effective clinical practice. Therefore, self care is not merely a personal choice but a professional responsibility that protects both counselors and their clients they serve. Understanding self-care in counseling, self-care refers to deliberate and evidence-based activities that maintain the physical, emotional, psychological, social, and professional well-being of counselors. Professional self-care includes physical wellness, emotional regulations, reflective practice, clinical supervision, professional development, healthy work life balance, personal physiotherapy. When necessary, research demonstrates that counselors who consistently practice self care experience lower levels of emotional exhaustion, higher professional satisfactions, and stronger therapeutic relationship with clients. For ethical foundation of self-care, self-care is an ethical responsibility for counselors. The ACA and APA emphasize that counselors must maintain their physical, emotional, and mental well-being to provide effective service. Self-care is guided by four ethical principles. Beneficence promote client well-being, non-maleficence avoid causing harms, faithfully build trust with client, professional competence practice only when fit to provide counseling. Without proper self-care, counselors may experience burnout, make poor decisions, and risk violating professional ethics. For counselor employment occurs when personal stress, physiological difficulties, or emotional exhaustion interfere with professional competence. Common indicator includes reduced empathy, poor concentrations, emotional detachment, impaired clinical judgment, boundary violations, decision making difficulties. Burnout should therefore be considered not only an occupational health issue but also an ethical concern because impaired prac- practitioner may unintentionally compromise client welfare. Burnout and compassion fatigue. Burnout develops gradually through prolonged occupational stress and excessive workload. Characteristics include emotional exhaustion, depersonalization, reduced personal accomplishment, compassion fatigue differs because it develops through repeated exposure to clients' traumatic experience. Symptoms include emotional numbness, secondary traumatic stress, loss of empathy, psychological withdrawal. Recent systematic reviews conclude that effective supervision, organizational support, and consistent self-care significantly reduce these risks. Evidence-based personal self-care plans, SHAWAL. An effective self-care plan includes physical, emotional, psychological, and professional well-being. Counselors should exercise regularly, eat a healthy diet, get enough sleep, and practice stress management techniques such as mindfulness. They should also seek clinical supervision, participate in continuing professional development (CPD), and maintain professional boundaries. Research shows that combining personal self-care with organizational support is the most effective way to reduce burnout and maintain professional competence. For critical analysis, although self-care is frequently promoted as an individual responsibility, recent evidence argues that it cannot effectively prevent burnout without organizational support. Heavy caseload, administrative burden, insufficient supervision, and limited workspace resources contribute significantly to counselor burnout. Therefore, counseling organizations also have ethical responsibilities to promote manageable workload, provide regular supervision, foster supportive workspace culture, encourage professional development. Sustainable ethical practice requires collaboration between practitioners and organizations. For the conclusions, self-care is no longer optional within professional counseling practice. Evidence demonstrates that counselors who actively maintain their psychological well-being are better equipped to provide ethical, competent, and effective service. Conversely, neglecting self-care increases the likelihood of burnout, compassion fatigue, and impaired professional judgment. Ultimately, self-care protects not only the counselor but also the safety, dignity, and well-being of every client served. Ethical counseling therefore begins with ethical responsibility toward oneself. Thank you.